Hello and welcome. Today we're talking about olive oil, specifically extra virgin olive oil, and this is one ingredient that can genuinely transform your approach to gout management through its powerful anti-inflammatory properties. Let's start with the remarkable compound that makes olive oil special, oleocanthal. This is a natural compound found in extra virgin olive oil that has anti-inflammatory effects similar to ibuprofen. Yes, you read that correctly. Olive oil contains a compound that works like a non-steroidal anti-inflammatory drug. The research on oleocanthal is fascinating. Scientists discovered that it inhibits the same inflammatory enzymes, COX-1 and COX-2, that ibuprofen targets. Obviously, eating olive oil won't replicate the immediate pain relief of taking ibuprofen, but regular consumption provides consistent, low-level anti-inflammatory effects throughout your body. For gout, which is fundamentally an inflammatory condition, this matters enormously. You're dealing with chronic inflammation in your joints when crystals form. You're dealing with systemic inflammation that often accompanies metabolic syndrome. Olive oil addresses inflammation at a fundamental level. Olive oil is purine-free. It's a pure fat with no protein content, so there are zero purines. From a uric acid perspective, olive oil is completely neutral. It doesn't increase uric acid, but it also doesn't directly decrease it. What it does is fight the inflammation that makes gout attacks painful and damaging. The type of fat in olive oil is primarily monounsaturated fat, specifically oleic acid. This fat profile is associated with numerous health benefits: improved cardiovascular health, better insulin sensitivity, reduced LDL cholesterol, and decreased systemic inflammation. These are exactly the metabolic improvements that people with gout need. Here's a critical point about replacing saturated fats with olive oil. Gout patients often have cardiovascular risk factors. Many have high cholesterol, high blood pressure, and elevated triglycerides. Replacing butter, lard, or other saturated fats with olive oil improves your lipid profile and reduces cardiovascular risk. That's disease prevention beyond just gout management. The practical application is straightforward. Use olive oil as your primary fat for cooking and dressing foods. Drizzle it on salads. Use it for sautéing vegetables. Roast foods with it. Use it in marinades. Replace butter on bread with olive oil and herbs. These simple substitutions accumulate meaningful health benefits. Now, quality matters significantly with olive oil. Extra virgin olive oil is essential. This is oil extracted through mechanical pressing without heat or chemicals, preserving the natural compounds including oleocanthal and antioxidants. Regular olive oil or light olive oil has been refined and has lost most of these beneficial compounds. Look for bottles labeled extra virgin with harvest dates or best by dates indicating freshness. Olive oil degrades over time, especially when exposed to light and heat. Buy from reputable sources and store in a cool, dark place. Use within a year of opening for best quality. The flavor of high-quality extra virgin olive oil can be robust, slightly peppery, or even cause a slight throat tickle. That throat sensation is actually an indicator of oleocanthal content. If your olive oil tastes flat or has no character, it may have been refined or is low quality. One caution about cooking with olive oil: while it's stable at moderate heat, avoid using it for high-heat cooking like deep frying. For sautéing and roasting at moderate temperatures, up to about 375 to 400 degrees Fahrenheit, it's excellent. For higher heat, consider avocado oil or another high smoke point oil. The calorie content of olive oil is about 120 calories per tablespoon. That's similar to any oil or fat. For people watching their weight, this needs to be accounted for. However, olive oil is satisfying and improves the flavor of foods, which can help you eat more vegetables and whole foods. The net effect on weight depends on overall diet quality. Portion control is important. Use olive oil generously enough to enjoy its benefits and make food taste good, but don't use excessive amounts. A tablespoon or 2 per meal is typically appropriate. Measure initially if you're not sure how much you're using. Olive oil is central to Mediterranean-style diets, which are consistently associated with lower rates of chronic disease, including cardiovascular disease. People with gout can benefit enormously from adopting Mediterranean dietary patterns, and olive oil is a foundational component. The antioxidants in extra virgin olive oil, including polyphenol and vitamin E, provide additional anti-inflammatory and protective effects. These compounds fight oxidative stress, support immune function, and protect cells throughout your body. The cumulative effect is systemic health improvement. Let's be realistic about what olive oil can and can't do. It won't cure your gout. It won't eliminate the need for medication if your doctor has prescribed it. It won't allow you to eat unlimited high-purine foods without consequences. What it does is provide steady anti-inflammatory support while improving your overall metabolic health. Think of olive oil as a daily investment in reducing inflammation. Every meal where you use olive oil instead of butter or margarine is a meal where you're actively fighting the inflammatory processes that contribute to gout and related conditions. One practical tip: create an olive oil-based salad dressing you enjoy and use it regularly. Combine olive oil with lemon juice or vinegar, add herbs and garlic, season with salt and pepper. This becomes an easy way to consume olive oil daily while making salads more enjoyable. Olive oil pairs excellently with gout-friendly foods. Drizzle it on steamed vegetables like broccoli or asparagus. Use it to roast bell peppers and sweet potatoes. Mix it with herbs for dipping whole grain bread. These combinations create satisfying, flavorful meals that support your health goals. The cost of quality extra virgin olive oil can be higher than other oils, but consider it a health investment. You don't need expensive artisanal bottles. Mid-priced, fresh extra virgin olive oil from reputable brands provides excellent value. Buy in sizes you'll use within a few months to ensure freshness. In conclusion, olive oil, particularly extra virgin olive oil, is one of the most valuable dietary components for gout management. It provides anti-inflammatory compounds similar to NSAIDs, improves cardiovascular health, and supports metabolic function. It's purine-free and versatile. Make olive oil your primary fat source, and you're making a significant positive change in your overall health profile. This isn't just about gout. It's about comprehensive health improvement. That's the power of choosing the right fats. Thanks for listening.